No sound this time, guys.
Just kidding. We're back. So our technical gal over there, not so technical apparently. Just kidding. Oh, yep. Loud and in person. We're back talking about breast cancer detection and awareness and all that good stuff that we were just talking about that nobody could hear. So that was fun. So we're going to do this again. So we're wrapping up a conversation from last week that we started with Morgan, and we got some questions from some viewers from last time. So thanks, guys. I'm going to try and replay everything we did. Thanks so much for calling in. You're giving us some good questions to answer here. Look, this time we immediately have 3 viewers. So everyone that
we did.
Everyone came back. We didn't lose them for forever. So we'll get started again. I'll do them in order this time. So, are there any blood tests that a patient can get to detect breast cancer? This girl.
No, unfortunately, there are no blood tests to detect breast cancer.
Short and sweet. There are none.
There were none.
Okay. Easy enough. So for the folk that was wondering previously, no. Can an X-ray detect breast cancer?
No.
Short and sweet, no. If, because you brought up a good point last time, if an X-ray detects breast cancer,
there's no bueno.
It's not a good sign.
If it's that large that you see it on an X-ray, like it's probably metastasized by then.
Not good. So you don't want an X-ray detecting your breast cancer.
Not a good screen.
Not the best. A good question. What is the best test to detect breast cancer? What's the best way to detect breast cancer? And I'll only ask it once this time.
Well, the best way to detect breast cancer probably is, again, to get see a provider and get a good history. Look at many, what sort of risk factors that one has to get a good clinical breast examination, and then get diagnostic mammography. There's new techniques out there. There's something called tomosynthesis, which is a 3D mammogram, essentially. It adds another dimension, or the axis, if you will, to the mammogram, so you can get a better interpretation of the breasts, particularly if they're dense. I don't think it's currently approved across the board for most insurances, and that's more of a reflection, I think, of insurance practices and cost. But definitely a better way to go rather than just your plain old mammogram.
So before we realized there was no sound on our last video, we were following up on somebody who had asked a question about 3D mammograms and basically if there is or isn't a recommendation for those. And Dr. Chinn had mentioned that it is a better test to detect breast cancer. However, as Morgan touched last time, as someone had asked, just like an MRI would be better to detect any sort of abnormality, your insurance unfortunately doesn't always cover it unless there's some pretty severe clinical indications that it's needed. So unfortunately, yes, those tests, from my understanding, are better. However, they're not always
they
obtainable.
Can be, but the mammogram still remains the gold standard. Sometimes I do order a mammogram if there's significant scarring, if there's a particular problem with difficulty looking at breast implants. But yeah, healthcare is a difficult topic with respect to insurance companies.
With all due respect.
Yes.
So somebody was talking a little bit earlier today about if a patient has implants. Maybe if they decided to, so kind of a two-for question, maybe if they decided to get implants to have them, or if they have implants maybe post mastectomy, maybe a history of breast cancer. How would you then recommend going about early detection then?
When you have scars on your any sort of tissue, it makes it more difficult to interpret any study that you do. So it just kind of adds another layer of complexity to your clinical examination as well as for interpretation of any study that you do. So just have to, fortunately, in some instances, get more frequent studies. Like your doctor might refer you for every 6 months mammograms instead of every year.
What about those folks who electively get breast implants and maybe a little bit more difficult to have a mammogram done?
Mm-hmm.
What would be necessary? I mean, I shouldn't say what would be, but what could their line of detection be? How, other than self-breast exams, is there anything that they can do otherwise preventatively besides knowing their own breasts?
That's basically it. Just knowing your own breasts, knowing how they feel, and being aware of your body. If there's any other significant changes, any abnormal breast pain, any changes to the skin, definitely that needs to be further evaluated.
And for those of you who didn't join us last time with Morgan, or if you hadn't watched the video yet, number one, I highly recommend that you go back and watch the Facebook Live from last Friday with Morgan, because there's a lot of good information in that one as well. And I'm sure you will echo on this of knowing your own breast, not being afraid to examine your own breasts and make sure you know, if there's a lump there, if that's been there, how long it's been there,
Exactly.
if it's changed. And again, if you didn't join us last time, and Morgan was kind of talking about the types of breast exams and when to do them, and I feel like it's important to kind of touch on it now, as far as when a woman is doing a self-breast exam, should they just be feeling their breasts, or kind of what's the vicinity that they should be focused on?
So this self-breast awareness is just kind of knowing not only your breast tissue and the nipple or the areola, but also be cognizant of what's going on in the armpit, because there is some breast tissue going to the armpit, to those spuds, that we need to also kind of be aware of. And usually when a woman has breast cancer, it travels first to the lymph nodes inside that axillary nodal chain. So make sure that you also examine your breasts in your the extension into your armpits. So, and there's no, like Morgan said in her other podcast, the
Facebook Live.
Sharing these young kids narrative.
Back in my day.
It's just, there's no one way of doing your breast examination. Some people like to kind of push down and kind of feel in a circular pattern. Other people like to just kind of push down and move in an up and down fashion. There's no really one way to examine your breasts. It's just whatever way you feel most comfortable with, and just being cognizant of, oh yeah, like this area right here is a little bit softer, and this other area is a little bit bumpier, but being aware of what's normal for you is the main thing.
If a patient, and for Nicole McDonald is asking a question there. Everybody can see it.
Oh, really?
Yeah.
Sorry.
That's okay. I know. No, everybody can see, because she's asking what's a good age to start mammogram.
Yeah, Nicole, I just want to give a shout out to James from Akron.
She's asking what's a good age to start mammogram.
Yes. Well, that's, I think, a discussion between a patient and her provider. There's, like Morgan said in her other Facebook Live, is that all of the major institutions for breast cancer screening have different recommendations. And the American College of Obstetricians and Gynecologists recommend age 40. Other institutions recommend age 50, but I think it's best to kind of sit down and talk to your provider and kind of talk about risk factors and in general, between age 40 to 50, I think is pretty good. But ACOG recommends age 40. So that's
for those screening mammograms.
Yeah, so that's what I usually do for my patients.
And you recommend a mammogram every year?
I think that's another conversation with your provider, because mammograms do give some amount of radiation. And I think that needs to be further discussed individually between.
So we had posted on our Facebook, I think just maybe yesterday or the day before, it was a great little picture of, I think it was lemons in a carton of different ways that you can, of what breast cancer may feel like. What are some, for anyone who hasn't seen that, it's a great picture, and I've actually seen it kind of floating around everywhere on Facebook right now, which is fantastic. If somebody felt a lump, what would some of those signs look like that they should maybe be concerned about? Is it painful? Is it hard? What are some things that kind of would, if you found one on yourself, would push you to go and be seen?
Just in general, anything that's abnormal, but that's a very good question. If I'm doing a silk examination, things that I'm looking for are basically tissue that is very firm, very painful, tissue that doesn't feel like it has an exact edge, or it's kind of diffuse, where you can't really see, oh, where does it begin and where does it end? That definitely, if you have any blood expressed from your nipple, if there are any skin changes, there's a term called peau d'orange, where the skin kind of looks like the peel of an orange, as it's translated in French, and that's kind of associated with inflammatory breast carcinoma. So just in general, if it's anything looks abnormal to you, take a look at it.
Or be seen. Yeah. If you're concerned at all, if you were concerned at all, call your doctor, call us, come see us, ask for breast exams at your provider's office. I know we had talked last time about providers now saying that doing a clinical breast exam is not necessary anymore, and some are saying that self breast exams are not necessary anymore. To my understanding, do them, ask for them, get them, know your breasts, and I know we talked last time about, you come in and see either you or Morgan, and you get a breast exam, and you say, I noticed this lump, and then they feel, and they can, providers can say, oh, that's just breast tissue, or that's something we should, have looked at. But nobody will know your breasts better than yourself. Yeah. You should touch your boobs, feel your boobs, know your boobs, right? Really make sure you're getting them checked, and ask if you want a breast exam, and there's been plenty of occasions where, maybe you feel something that you're worried about, and you want a provider to feel it too, to be, should I be worried about this? Am I worried about nothing? And, if a provider says, that's not necessary for me to feel that your boobs better than me, that kind of can leave people with oh, okay, so either I'm being paranoid, or now I'm even more scared because I don't know what it is. So ask for a second opinion, go somewhere else, get a second opinion. But I think the biggest thing we can preach is to know your breasts, know your boobs.
Yep.
Touch your boobs.
That kind of sounds a little
risque.
Yeah.
But know them.
Yes.
Know your boobs.
All right. I think that should be it.
I think we covered all of our questions that came in from last time.
Yep.
So if anybody else has any questions, hello to everybody saying hi. I know you're saying hi to her, not me. That's okay. If anybody has any other questions, don't hesitate to call our office, message us, email us, stop by, say hi. We're here. If anybody needs a breast exam, call us. We'll get you in for an appointment. If anybody needs primary care, call us. We now offer primary care. But yes, please Do your breast exams.
Stay in school. Don't
Prevention
do
is
drugs.
key. If you feel something, say something. Yes? Anything you'd like to add? Anything else you'd like to
Don't
add?
run with scissors.
Say please and thank you. Give us a call, guys. We'll see you next week. Bye.